Wonderful day, everyone. This is Eugenie Herrera from Davao Doctors College, your student nurse. Today, I'm going to perform a Leopold's maneuver to determine the position of the baby inside of the utero, to know the presentation, attitude, and to listen to the fetal heart tone. So let's begin. So the necessary materials that we need is a pillow, a blanket or towel, and the stethoscope to listen to the fetal heart tone. So now, we're going to perform a hand washing or hand hygiene to protect the patient, ourselves, and to have an infection control. Once we're done, we're going to explain the procedure to the patient. Hi ma'am, makikipagtag ako din yung student nurse karong adlaw. Mag-perform po Leopold's maneuver. Leopold's maneuver man is maghikap ko sintiyan para makabalo ta sa plastada ni baby o para makapaminaw po ko sa fetal heartbeat niya para kabalo ta sa status. Ay, dili mo siya sakit ma'am, so relax lang ta. Once explain the procedure to the patient, and the reason for that is so that the patient will have an idea and will cooperate with us during the procedure. And now we're going to instruct the patient to empty her bladder so that it will not misinterpret the result of the procedure. Ma'am, kailangan ba yung takapaihion para tama o eksakto atong resulta sa procedure, ma'am? Oo, okay lang. Alright, thank you so much for that, ma'am. Once it is explained, now I'm going to provide privacy for the patient. We're going to close the curtains. We don't want that our patient will be embarrassed. So, close the curtains, lock the doors, and we're going to position our patient on its supine position. One pillow under her head to promote comfort, and knees are slightly flexed to have stability while we're doing the procedure. And now we're going to make sure that we're going to tell that the patient we're going to start, and we're going to position ourselves on which dominant hand that we're going to use. In my case, I'm using my right hand, so I am on her right side facing the patient. We're going to do that to have an easy access to the abdomen with our dominant hand, and we're going to expose the necessary area only, and always warm your hands before touching the abdomen so that the patient will not be get shocked with our cold hands. So once it is warm enough, we're going to tell the patient that we're going to start. Ma'am, magsugod na kong hikap siyang tiyang ma'am, ha? Alright, salamat kayo ma'am. So the first that we're going to do is the fundal grip. The first maneuver, we're going to place our hands on the fundus. And for this fundal grip, the purpose of this is to know which part of the baby lies on the fundus. And our technique that we are using, by the way, is we're going to use the palm of our hand. We're not going to use finger to feel it. We're going to use the palm of our hands, and we're going to put a little bit pressure. This is the technique, by the way. It's uncompleted triangle. It will be look like this. So we're going to place there to feel the baby. And there will be two possible findings actually. It will be a soft nodular feeling, which will be the buttocks, or a massive mass, which will be the head. The normal actually will be the buttocks. It will be a soft nodular. But in some cases, there is sometimes a head that will be lies on the fundus, or maybe the back. So sometimes there is some rare cases that it happens like that. So once we feel on the fundus, we feel which part of the baby lies on the fundus, we're going to confirm it to make it sure. And in my case on this procedure, we feel that there is a soft nodular on the fundus. Alright. After we make sure that which part of the baby on the fundus, we're going to continue with the second maneuver. So for the second maneuver, we're going to place our hand on each side of the abdomen, but the technique here actually will be the same. It will be palm of our hands that we're going to feel, that we're going to use to feel a baby, but on this umbilical grip, we are not going to feel the baby spontaneously. We're going to only use one hand for exploration and one hand to support stability of the abdomen. So this one will be steady, and this right hand will be exploring. And the umbilical grip, what we're trying to do here is to locate the fetal back. The fetal back will be a long flat surface. Going to put that here side of the abdomen. Watch that. This will be steady. This will be exploring. We'll put a feeling there. Try to feel, and what we are trying to feel is either the soft nodular feeling as well for extremities, or a flat surface. And in my case, I'm assuming that this is the fetal back, and this fetal back will be flat, long surface. And we need to remember this. We need to remember which area of the fetal back is, because that is the area that we're going to put our stethoscope to listen for the fetal heart tone. So fetal heartbeat, we're going to place our stethoscope there. We have to remember, we're going to note that later on. Once we feel it, once we already identify this is the fetal back, we're going to put this as a support to stabilize the abdomen, and the other hand will be exploring. And what will be felt here, as we assume that the fetal back is here on the right side, it will be on the left side, it will be the extremities, which will be a soft nodular feeling. And once we are done with the umbilical grip, we're going to proceed with the third maneuver. The third maneuver will be a different technique. We're going to use thumb and pointy finger, or this. It will be L-shaped, and we're going to place this on the ovary symphysis pubis. And what we're trying to do is to feel the head of the baby. So we're going to place that here, symphysis pubis, and we try to grasp, and we're trying to feel the massive mass. That's the head of the baby. We feel that. It will be like this. We put that here, and if we could be able to grasp it to feel the head of the baby, if we could be able to move it. By the way, I'm sorry, Pollux maneuver. What we are doing is Pollux maneuver to determine if the baby is floating or engaged. So that's what we are trying to do here on the third maneuver. So here we assume this is the baby inside of the abdomen. We put that there. We can be able to move it. It means it's floating. And if we can be able to lift it, it's floating. If we're not be able to move it, it's not movable. It means that the baby is engaged, and sooner or later it will be delivered. So now it will be like this on a reality setting. We're going to put that there, going to grasp and lift a little bit. And the one that we're trying to feel is the massive mass. If we could be able to move sideways, it will be floating, as I mentioned. If we'll not be able to move like this, I believe at this point the baby is engaged. But that is only an example. Alright, after we feel that, after we are sure that the fetal back, after we are sure that the fetal head is over the symphysis pubis and we felt it, we confirm it, we're going to proceed with the last maneuver, the fourth maneuver, which will be the pelvic grip. So the pelvic grip, at the beginning we're facing the patient, but now it will be we will be doing the opposite. We will be facing the feet of the patient, and we're going to confirm the result of the third maneuver. We're going to determine the presentation of the baby, the attitude, or is it flexed or is it extended. So Same technique of the first and second maneuver. We're trying to feel it by the palm of our hands and complete a triangle. So we're going to position this over the symphysis pubis. We're going to feel, is it extended, is it flexed, and slowly going down to the abdomen, side of the abdomen. And once we identify that it is extended or flexed, we're going to note that, document that later. We'll have to remember. And if you're sure now, that's it. We're going to get the fetal heart tone of the baby. We're going to remember the fetal BAP as we locate that using the second maneuver. So on that here, we're going to use our bell of the stethoscope, because bell of the stethoscope is intended to pick up low frequency sounds. And if we're going to use this diaphragm, it will not be effective at all, because the diaphragm are for the high frequency sound. So always remember, guys, that always remember, people, that if we're going to put the stethoscope on the mother's abdomen, we have to we have to let them know that we're going to put the stethoscope, because sometimes our stethoscope are metal, it will be cold for them. Ma'am, mamina na po sa heartbeat ni baby. May butang ako stethoscope naman kasi bugnaw niya siya naman. Alright, as we put that here, we're going to listen for 1 full minute and observe the tone and the character of the heartbeat. Alright, tapos na ato, ma'am. Tumina ko na sa fetal heartbeat ni baby. Thank you. Once we have the findings of the fetal heart tone for 1 minute, we're going to note that, document that. But before we document everything that every result that we conduct here today, we're going to provide a comfort first for the patient. We're going to cover the exposed area. We don't want that our patient will catch chills. We don't want that. And once we settle everything and provide comfort to the patient, we're going to document now. And thank you so much for watching. That's all for Leopold's maneuver. Have a great day.